FFD and varus deformity bilateral knee. So this is how this preoperative picture looked like. Towards the right, we had the patient when he was operated on bilateral knees. The preoperative radiograph of this patient with defect on the medial side, varus and FFD. This is the hip knee ankle radiograph, what we could achieve. I usually like to do patellar resurfacing in all my cases. Towards the left, we have the right knee after total knee replacement with patellar resurfacing. The left knee with patellar resurfacing. This is how the patient walked before the surgery, and this is how the patient was walking immediately the very next day of the surgery. And this is the recent follow-up of the patient. So coming to the next case, we again had a 68 years male, bilateral, severe varus and FFD. The preoperative outcome and the post-operative outcome in the same picture. Again, a hip knee ankle radiograph which shows varus deformity towards bilateral knees. Right side patellar resurfacing after total knee replacement, left side total knee replacement with patellar resurfacing. This is how the patient used to walk before surgery. This is how the patient is walking after surgery with straight knees. We usually make the patient do high sitting active knee extension from the very next day of the surgery as a part of the accelerated physio rehab protocol. This is the recent follow-up of the patient, what we could achieve. This is the patient with his attempt in sitting cross-legged on the day his stitches were removed. So again, 73 years male with deformed knee, bilateral varus knee, straight ones after the surgery. The preoperative radiograph showing defect towards the medial side, varus knees. The right knee with patellar resurfacing done, left knee with patellar resurfacing done. These are patients who could not even take few steps without the assistance of anyone. So this is how the patient used to walk pre-operatively. This is how the patient is walking post-operatively. Again, as a part of the accelerated physio rehab protocol, we make the patient do high sitting active knee extension from the very next day of surgery. So again a 65 years female from Nepal with bent knees. The pre-operative and post-operative outcomes in the same picture. This is our pre-operative radiograph, the post-operative radiograph, right knee with patellar resurfacing, left knee with patellar resurfacing. This is how she used to walk before surgery, with bent knees, with straight ones after surgery, and again as a part of the accelerated rehab protocol, isolating active knee extension from the very next day of surgery. So the next series is the fracture series. We had a patient who came to my OPD with bent knees. We planned TKR for that patient, and unfortunately by the time she reached home, she had a fracture of her femur. So she came to us, we did an intramedullary nailing of the same patient, and again because of her severe knee arthritis, she was not able to bear weight. So we waited for 4 months for the fracture to consolidate, and after that we planned a total knee replacement for this patient. Again, a right knee replacement with patellar resurfacing. This was a bit of a challenging case for us because we don't have access of navigation or robotics at our center. And we also didn't have any access to extramedullary alignment guide. So with eyeballing, appropriate valgus was achieved at femur. This is the right-sided radiograph, the left-sided radiograph, TKR with patellar resurfacing. We made the patient walk the very next day of the surgery, and this is the patient with her recent follow-up. So, 65 years female, again with bent knees. She was a rheumatoid patient. The pre-operative and the post-operative outcomes in the same picture. So this was a pretty interesting case because towards the lateral radiograph we have a very unique deformity which is known as a cup and saucer deformity. These kind of cases are very prone for MCL avulsion, and unfortunately when we opened up we found a huge bone cyst lying towards the medial side which was compromising the integrity of the MCL. We filled it with the bone grafts which we obtained from the tibia cuts, applied a philosphate in reverse. So this was the radiograph, right side complex TKR after patellar resurfacing, the left knee with patellar resurfacing. This is how she used to walk before surgery. This is her follow at 6 weeks. So with bent knees to straight ones, she at present is able to do all her activities of daily living. So coming to the next series, the Windsor deformity series. So again a 68 years female, a 96 kg weight, with valgus towards the right, with varus towards the left, with straight knees after the surgery. The right knee was in a valgus orientation, the left knee was in a varus orientation. So this is her post-operative radiograph with the right-sided patellar resurfacing done, left-sided patellar resurfacing done. Fortunately, we could get out of this case without use of a CCK insert. So this is how she used to bear weight before surgery. This is how she bore weight the very next day of surgery, and this is her radiograph. This is her follow at the current scenario. So a patient who was not able to go even to the toilet by herself is now able to do at least all activities of her daily living. So again, I just did this case recently before I came over here. So again, a Windsor deformity with straight knees after the surgery. The left knee in a varus orientation, the right knee in the right knee in a valgus orientation, the left knee in a varus orientation. Again, post-op TKR, left TKR with patellar resurfacing, right TKR with patellar resurfacing. Again, we could get out of this case without use of a CCK insert because intra-op it was well stable. This is how lax the left knee was. Again, if I show you the laxity of the valgus knee, this is how lax the right knee was. This is her laxity, post-op laxity towards the right knee without the use of a CCK insert. And this is the laxity of the left knee without the use of a CCK insert. She was not able to bear weight since past 4 months of her surgery, and after the surgery we made the patient bear full weight, walk with walker assisted ambulation. So this is the patient walking immediately the very next day of surgery. So again, a 74 years male with severe deformity, various deformity towards bilateral knees. A staggered TKR was planned for this patient because of a cardiac comorbidities, with the post-operative outcome in the same radiograph, in the same picture. So we had a huge posterior medial defect towards the right knee. If I show you the CT and towards the left knee as well. If I show you the CT of the right knee, we can see a huge posterior medial defect. Again, bilateral complex primary TKR was done in this patient with patellar resurfacing. So this is how the patient used to walk before surgery. And this is how the patient is walking when his stitches were removed for the second knee. So coming to the next, this is again a 54 years male with various deformity towards the left, straight knees after the surgery. Huge defect was there, which I will show you in the coming slides, with various deformity towards the right knee. This is the post-operative radiograph, how it looked like. Right. There was a huge medial defect towards there was a huge defect towards the medial femoral condyle. This is how the patient used to walk before surgery. This is how the patient is walking immediately after surgery. As a part again of the accelerated physio rehab protocol, we make the patient climb stairs within 72 hours of the surgery, and this is how the patient is walking on the day his stitches were removed. So again, 78 years male with various deformity towards the left side. This was again an interesting case. There was huge defect towards the lateral femoral condyle. There was a huge defect towards the medial femoral condyle. If you look towards the tibia as well, there was a huge defect. Multiple bone cysts were there. There was the entire tibia was like a honeycomb. So again. Primary complex TKR was done. We could not do patellar resurfacing in this patient. Again, this is his outcome on the day his stitches were removed. We made the patient climb stairs a bit late. This is he climbing stairs on day 14 of his surgery, and this is his attempt at sitting cross-legged. So part 5, the overweight series. 135 kg male with a bilateral knee arthritis. This is his pre-operative radiograph, how it looked like. The post-operative radiograph. Right knee with patellar resurfacing, the left knee with patellar resurfacing. Again, a staggered TKR was planned for this patient 14 days apart. We, as a part of accelerated physio protocol, he is doing high sitting active knee extension, and this is the patient walking when at 6 weeks follow-up. So 120 kg male, again with bilateral varus deformity, straight knees after the surgery. The pre-operative radiograph, how it looked like. The post-operative radiograph, right and left knee with primary complex TKR with patellar resurfacing. We made the patient bear full weight immediately the very next day of surgery. High sitting active knee extension from the very next day of the surgery. And this is his follow-up, what we could achieve lately. So 110 kg male, again 75 years, bilateral varus knee with straight ones after the surgery, bilateral varus deformity at both the knees, left knee with patellar resurfaced, right knee with patellar resurfaced. This is how he used to walk before surgery. This is how he was walking immediately after surgery. High sitting active knee extension from the very next day, and this is his video, what we could retrieve lately. So, 80 years female, 96 kg, bilateral varus knee, straight ones after the surgery. Sitting, we made the patient sit with legs hanging by side of the bed the very next day of the surgery. Again, bilateral knees, bilateral severe OA, both knees. The right knee with the patellar resurfacing done, the left knee with patellar resurfacing done. She used to be carried to the toilet by her son and at least 2 people before surgery. This is her walking 7 days after surgery, and this is her walking 21 days of surgery. Now she can climb stairs, go to the market, do all her activities of daily living. So again, these are some of the patients with attempts at cross sitting after the surgery. These are some of our patients doing cycling as soon as 4 weeks after the surgery. And we had a very interesting patient from Nepal who was actually a bouncer, a 96 kg male. He underwent he's an active mountain climber and a cyclist, underwent a single knee replacement with us. This is his follow-up immediately the next day of the surgery. If I show you the coming video, this is his follow-up on day 14 of his surgery when his stitches were removed. And this is the same patient cycling on day 21 of the surgery. So thank you so much for your kind and patient hearing.